Hello, everybody. My name is Dr. Margo Mountjoy, and I'm here to talk to you today about returning our athletes safely to the swimming pool post-COVID-19. Is it safe to get in the water? For those of you who don't know me, I'm a clinician scientist. I'm a sport medicine specialist and consultant and a researcher. I come from Canada. I'm a member of the FINA Bureau with the portfolio of sport medicine. I also have the privilege of sitting on the IOC Games Group, where I attend all Olympic Games on behalf of the Summer Olympic Federations, both youth and regular games. I'm also a member of the World Anti-Doping Association's Health, Medicine, and Research Committee, and I chair the Medical and Science Committee of the Association for Summer Olympic International Federations. It's a pleasure to be here today with the aquatic family, and I thank particularly CCCAN and President Felix Calderon for the kind invitation. I understand that there's also guests attending today from Zone 1, Gonsenad, as well as Zone 3 and 4. So welcome, and thank you for your interest and your attention to your athletes' health and well-being. For the next 40 minutes or so, we will have a presentation on the latest science and recommendations, followed by a question and answer. So for today, just to review a summary of what we'll discuss, we're going to first talk about the effects of COVID-19 on athlete health. And I think this is important for all of us to understand that this disease may have an impact on our athletes' performance as well as their health, and what prevention measures that athletes, coaches, and all involved in sport should participate. And then we'll dive into things like training, returning to competition, and then what to do if your athlete becomes suddenly ill with COVID-19, and then how do we return them to training after being ill of COVID-19. And before we get into the question and answers, I will leave you with a slide. I'm sure these slides will be available to you after the talk with some references should you wish to look more further into some of the scientific data that I used to compile this presentation today. So we'll get started first by talking about the effects of COVID-19 on. So I guess we need to start with what is the coronavirus. And I'm sure we all are familiar and have spent time over the last 2 months hearing on television what this coronavirus is. It's a large group of virus. SARS was a coronavirus as well. But this particular coronavirus, SARS-CoV-2, it causes respiratory illness in humans. It was originally in animals and then was transmitted to humans in Wuhan, China, first identified in December 2019. And because this coronavirus causes a disease, the illness from the coronavirus is called CO for corona, V for virus, D for disease, and 2019. So COVID-2 is the illness caused by the virus. So what are the effects on athlete health should their athletes become infected? Well, thankfully, 80% will recover without any treatment. However, what are the signs and symptoms? So most common, I'm sure you've heard, fever, cough, and fatigue. Fairly common. However, there are less common ones that you should be familiar with, and that can be headache, irritation to the eyes, and interestingly, loss of taste or smell. I know one of the tests that done in my area is a question just saying, does peanut butter still taste like peanut butter to you? So this alteration in the sensation of smell and taste. People can complain of sore throats, aches and pains, and diarrhea. And in fact, we do know that coronavirus can be spread through diarrhea in polluted waters. So 1 in 5 people will become very ill, though, developing shortness of breath, chest pain, and different difficulties with cognition. 43% will get muscle pain. So that's almost half of the people infected will have infection in their muscles, or myalgias, myositis, we call it in medical terms. But having illness in your muscles can affect the muscles that we use to swim. So if you've had someone with COVID, an athlete with COVID, they may be quite weak. They may have muscle pain and not have the same strength and capability. 20% will get pneumonia. So if you have a team of 10 athletes and 2 become ill, if you have 10 athletes that are ill, 2 of them will develop pneumonia. Pneumonia is an infection in the lungs, can be very serious, can lead to pneumonia or fibrosis in the lungs, which can affect oxygen transportation and carbon dioxide diffusion. So very serious in terms of sport performance. Of those who become ill, about 2.5% will require ventilation in an intensive care unit. This is very serious and certainly can occur. The serious illness, it appears to be mitigated by an inflammatory response in the body where the virus stimulates the body's immune system, but the immune system seems to go haywire and go crazy. And that immune system starts to wreak havoc in the body's systems that affects multi-systems, such as impairs the clotting of blood, so the athlete or the individual who's unwell develops thromboses or blood clots. They may get fibrosis in their lungs or this fibrous material in their lungs, which makes breathing difficult, not to mention oxygen diffusion. It may affect the muscle of their heart. We call it myocarditis, which is not good in someone who needs to exercise, and can cause rhythm problems, which can be very serious indeed. It can also affect the peripheral nerves. I mentioned already the skeletal muscle, the liver, and the kidneys. And who's at risk for the more serious illness, of course, are the elderly, and we've heard that, and as well of the individual who's immunocompromised. So someone who has other health problems or is having chemotherapy with a decreased immune system. Now, please note that our athletes are often immunocompromised from heavy training. I see it all the time, especially in my endurance athletes. Now, I mean immunocompromised, not like someone on chemotherapy, but they have a decrease in a heavy endurance training block, a decrease of their white blood cells. So they're in a semi-state of immunocompromise, which is a response to heavy training. So we must be very careful with athletes that are in heavy training of their exposure to people who are unwell. And of course, we don't know yet the effect of COVID on an unborn fetus, on the individual infant, because the virus hasn't been around long enough for us to understand and to know. So for our athletes, they may think they're young, they're healthy, and so what? They'll just get a cold and get better. But in fact, it's not so simple as that. They can have muscle involvement, they can have lung involvement, or the heart muscle itself be involved, which can affect their ability to participate in sport. And sure, 80% will recover without treatment and they carry on, but they're quite unwell for a couple of weeks. Um, and more importantly than that, during that time when they're unwell, they could infect somebody who indeed dies of this or becomes much more seriously ill. So I think it's very important that our athletes take this seriously, even though they think they're young and invincible, they're maybe not so invincible. We've had in my community certainly young people in the ICU on ventilators as well. It's not just an illness of the elderly, although the elderly more at risk. Anybody can become seriously ill with this. So let's talk a little bit about prevention. How can we prevent this? Some of these principles you will already know, but I will review them, and I encourage you to review them with your athletes because it doesn't hurt to hear it more than once. Number one, important prevention is physical distancing, and please don't call it social distancing. We do not want people to distance socially from one another. We want our athletes to remain connected as a team. We want them to stay connected to society, feel supported with their support groups socially, but maintaining physical distance. And that's because in physical distancing, that 2 meter spread between us prevents the number of droplets. If someone sneezes or coughs the virus onto you, if you're further away, you're less likely to become infected by the droplets. Now, a droplet landing on the skin will not infect somebody. It's when it's on the skin and then the person touches their eyes, their nose, or their mouth. So that is avoiding touching the face. The virus on the skin will not make you ill. The virus in your body is what makes you ill. So encourage your athletes not to rub their nose or lick their fingers or touch their eyes. Just hands away from the face at all times. Likewise, if you're physically distancing, you shouldn't be shaking hands. We shouldn't be hugging, and we shouldn't be kissing people. So greet people with a wave, a nod, or a bow, but to keep a physical distance. I'm sure you've heard talk of respiratory hygiene, how to cough, how to sneeze. Coughing into your hand is not the way to do it because then you go touch something and then you've infected everything you've touched. I'm sure you're familiar with the NBA player, the basketball player who touched all the microphones and then later tested positive, and he spread the disease to many people. So please, um, cough, sneeze into your elbow, and then go wash, but not on the hands and then touch things. Important to avoid unessential travel. Well, not many people are traveling these days anyway, but avoid unessential travel and large social gatherings. It's the large social gatherings. It was the wedding in Italy that started quite an outbreak in that city. There was a city in Canada that had a curling tournament. Curling is a game played on ice with rocks, and it's a great social event in the north. And this curling tournament was one that set out a big outbreak of COVID in that particular city. So large social gatherings are where things spread, and that's because people are together and spreading things. And then encourage your athletes to monitor their own health. Stay home if they're unwell. Stay home if they're unwell. Stay home if you are unwell. Do not go to work. Do not go shopping. Do not go to training. Stay home if you're unwell. Even if you're not sure what it is, stay home. And the WHO has provided this nice diagram on how to wash your hands. And you think, well, we all know how to wash our hands. But read it and follow it. It is actually something good. And I encourage you to teach your athletes. And probably the best way to teach them is show them by example. So showing them a diagram and then showing them you doing it and encouraging them when they're washing their hands to do it properly is really important. So let's move on. Let's talk about returning to training. So before they return to training, they should be pre-screened, and they should be pre-screened before every training session, not just the first one, but every one. And this can be done electronically on the day of training, or it could be done as they're arriving, but everyone should have these pre-screening questions. Have you been in contact with anyone who's been diagnosed with coronavirus in the last 2 weeks? Are you providing care for someone? Have you visited someone? Are you working together with someone who's been tested positive? Do you travel together? Do you live in the same household with someone? Are you in quarantine yourself? Now, the next one, have you been treated positive, tested positive, or had a PCR test? That's a special test to diagnose COVID. Or if you have any of the following symptoms in 14 days. So 14 days. So if they had it 13 days ago, they don't come to training. If they had it 15 days ago, they can come to training. And that's because that's the window for development of the illness. So it's please have them fill this out before they come. And for the anosmia and dysgeusia, the second last one, that means inability to smell and inability to taste. So you may wish to translate that for people into more easy, understandable English. So prevention at the pool. Well, let's talk before they get to the pool. Please encourage them not to use public transport. When they arrive at the pool, have the ability for them to wash their hands and watch them wash their hands and ensure they do it properly. May that soap and water is actually the most effective. So having soap and water able for them to wash. And if that's not possible, to have them use the gel, the sanitizing gel. Have them arrive just in time for practice so that they're not congregating around. They arrive in time just to jump into the pool. And in the facility itself, please ensure that they have ability to physical distancing and a pathway to walk in and walk out without coming in contact with other people. Discourage the high five, the hugging, the handshaping, the fist bumping. Encourage them to have proper hygiene when they cough and sneeze. Remind them to avoid touching their face. Do not share their drinks. Do not share their goggles or their hand paddles or their flutterboards. Bring their own equipment. Use their own equipment. Do not share the equipment and take their equipment home with them. Do not share their towels. Everything goes home with them afterwards, and when they get in the door, it's rubbed down by the hand sanitizer or those sterilizing wipes. The athlete takes a shower and washes their hands when they get in the door. Well, that's kind of a routine. That's probably not what they normally do, but this is something you must train your athletes for their own safety while they're training. How can you prepare your facility? Now, this is really important. Before your athletes come back, you have to make sure that your facility is ready for them. Make sure that your facility has the ability for them to hand wash upon arrival. Make sure that your facility has the ability to take a temperature as they walk in. That's really important. If they have a temperature, they go back home. If they don't have a temperature, they can come in. And they can be done fairly easy with a thermometer that's pointed at the head or in the ear, but just their temperature as they walk in the door. Organize the space in the facility to encourage physical distancing. Have arrows on the floor for a pathway that they go so they're not touching things along the way. They're not passing close by other people. Make sure the pathways are clearly laid out for them. Make sure that the surfaces are disinfected more regularly with a strong disinfectant. And this, tell them to avoid touching things, but they will touch. So clean it more frequently, and especially areas where they're more likely to touch. So light switches, toilet flushing, hand knobs, shower knobs, things like that. Really avoid touching them. Obviously, you need to wash their hands, but disinfect them in between everyone. Stagger their time of arrival so you don't have a mass group coming in at the same time. You can stagger their times of arrival so that you can control, like you see people being controlled to come into the grocery store so that they can come in without coming in a mass group. Encourage them not to arrive too early. They arrive only on the time that they can to begin training and leave immediately at the end. So these are things that you can have your facility. Let's talk a little bit about water quality. Well, there's some good work that's been done recently on this, and I must say I'm very relieved when I learned of these studies that the WHO, through our Dunio et al. 2020, found that coronavirus is inactivated in chlorinated water. So residual concentration of 0.5 milligrams per liter free chlorine, contact time of at least 30 minutes, inactivates at a pH of around 7, will inactivate the coronavirus, kills it. Aren't we lucky we're in this sport? So the recommendation is that the free chlorine levels are about or less than 1.5 milligrams per liter. So encourage that your facility has appropriate chlorinating procedures, and I'm sure they all do, but it doesn't hurt to double check, especially at this time. The CDC, or Center for Disease Control, said there's no evidence that the virus that causes COVID-19 can be spread to people in water and pools, hot tubs, spas, or water play areas. So very encouraging news from WHO and CDC. So make sure that your sport facility has adequate chlorination and your athletes should be fine in the water. So for training recommendation, please keep the same group of athletes training with the same group of athletes. Now this sounds simple, but it's very important. You don't want to have two groups of athletes where each training session you're intermixing the different groups of people because they're bumping into more and different people. In a way, you're almost creating another exposure bubble, we call it, where we have the same people that are exposed at the same time. And this is really important, not to mix your groups of athletes in each training session. Do not have dry land training in a group on the facility. Have them do their dry land training at home by video where you're either doing it all together or you're supervising them through a Zoom visit or something. So no group dry land training. Avoid the spectators. Parents, stay out of the building. Of course, if they must come in, physical distancing for parents so that they're appropriately 2 meters apart from each other in the facility, and that you can avoid do the hand washing and the appropriate pathways. Really, if possible, please have the parents and spectators stay away. Encourage your athletes during training, no sharing of equipment. What's theirs they come in with and no one else touches it. Do not share towels and water bottles, as I mentioned. Avoid congregating. For their workouts, please send it ahead of time. Please send it ahead of time so that there's not everyone congregating around a board and reading a single board, that they've got their own training session and they can either write it on their whiteboard that they bring and take home with them or on a laminated piece of paper, but something that they have their own training so that you don't have 3 athletes looking at one board. Show the diagram when you send their training, show them where they're supposed to be in. You might even want to put an X on the pool deck so they know where to go. Jack, you're in lane 1, Jane, you're in lane 2, Bob, you're in lane 3, and there's an X so that they stand there at the center of the lane. As I say, dry land individually at home. And let's talk about the stepwise approach. So step one, follow at all steps really, adhere to your public health recommendations. Your public health knows what the risk of COVID-19 is in your community and what the risk of spread is for this age of population. Their recommendations trump everything that I'm going to tell you today. If they tell you it's unsafe to be in that facility, it is unsafe to be in that facility. So please adhere to all your local public health recommendations for your facilities and for your opening of training. At step one, you're going to have one swimmer per lane. So if you have a 6-lane pool, you've got 6 swimmers in. So you're repeating the training for the next group of 6 athletes to follow. So one swimmer per lane, swim in the middle of the lane on the black line. So there's the maximum amount of distance between athletes at all times. It's up to you, of course, but I encourage that you bring your high performance athletes back first so that they can get in the water and get training, and then have them avoid physical therapies, massage, physiotherapy, chiropractic therapy at the pool. Really avoid it at all possible. If they're absolutely injured, then certain precautions must be taken into consideration, and these are led by public health, and they should be done in a very in a health facility that's properly organized for COVID to decrease COVID-19 risk. Step two, you're going to add 2 swimmers per lane, and here's the diagram that I've shown you here with 2 swimmers per lane. So here's a 6-lane pool with 12 swimmers, and you can see we've got the swimmers at each end of the pool, but they're staggered at the end of the pool, so they're not standing side by side at the ends of the pool. So that's step two. And in step three, you'll be adding another swimmer per lane, and you'll be adding in maybe lower or developmental swimmers at different times, depending on your pool space and availability. And of course, then finally, step four is where you have full training of unrestricted training, like the good old days. And we're not there yet anywhere, and I think we probably won't be there until we have an effective vaccination and treatment program. And that will come, but that will take time, and this will be our reality for some time to come. So what can the coach do? And I think it's really important that your coaching staff is well educated. So in particular about COVID-19, your coaches should be the experts on facility procedures. They're responsible for calling the shots in the safety of those athletes, as well as the sport federations. And they must ensure that those facility procedures are up to par, because it's your coach's health as well, and the family of your coach that can be affected by COVID-19. So that coach should be an expert and make sure that those facilities are properly cleaned, that there's physical distancing, and that there's hand washing available. They should also be well educated on the recent prevention advice on COVID-19 and any public health recommendations in their particular community. So we're going to make our coaches COVID-19 experts, and I think it's really important for them. It is their responsibility, the health and safety of their athletes, so they should be familiar with this information. So while at the pool, the coaches themselves should physically distance from the athletes and from other staff. So not a group of coaches over here and a group of athletes over here. Physically distance. And in some cases, you might want to put X's or at least lines on the side of the pool where, you know, if you've got 2 coaches there at a time, or you've got a lifeguard and a coach, that there's a line so that they don't walk into each other's space. Coaches do not share equipment. Please do not share your whistles. Do not share a pen. Do not share a clipboard. Do not share a stopwatch. Anything you touch, like the athletes, it's yours. You take it home and you sanitize it after every training session with a sterilized wipe. It sounds ridiculous. It sounds silly. Do it. Because COVID-19, you're probably not a healthy young athlete. You're probably a little bit older, and you may live with older people, or you have older people in your lives, or unwell people. So your own safety, and for those of your families and loved ones, please follow these advice as coaches as well. Please pay attention to your athlete mental health. Athletes are affected significantly by COVID-19 and the home isolation. I did a study recently on FIFA athletes, so footballers, professional footballers, where I did mental health screening of anxiety and depression in these professional athletes before COVID-19, before home isolation, and then once they were on home isolation. And I was shocked to see, I mean, we all know that we're all affected by this pandemic, mentally, but I was shocked to see the degree of anxiety and depression amongst these professional footballers, male and female, from home isolation. So your athletes are also feeling the same thing. They're feeling anxiety. They're feeling frightened. Might be frightened for their own health and safety. They might be frightened for others in their lives that are affected by this. They might have fear over their sport career and their future. They might be significantly affected. So please be careful, please be gentle, and please be on the watch out for any mental health problems and support them. Validate their feelings. They're real, and they should be supported, and get some help for them if they need it. Please note that there will be nutritional requirements. I've talked earlier about decreasing nutritional energy intake during periods of time when they're not training as heavily. But now that they're increasing their training loads, it's important to increase their energy intake to balance their energy outputs in training. So while they change their training, please pay attention also to the nutritional changes that will be necessary at the same time. And please, as I mentioned, avoid the physiotherapies if you can, because of the close contact of two people for an extended period of time, and the hand contact on the body. So please avoid if possible. Let's talk about some more coaching, actually. I'm sure you've heard of deconditioning. Well, that's what's happened in your athletes. They've been home for 2 months plus. They're deconditioned. They will have a diminished strength in their muscles. There was a recent study, literally published in February 2020, that showed a muscle that's not used in the quadricep and the hamstring can show weakness within 48 hours of not training. Now, that doesn't mean that they will be injury risk, but it can mean that over 2 months, they will have significant decrease in strength. Their muscles will be less flexible. They will have a significant fall in cardiovascular fitness. They will have a decrease in their endurance capacity and significant increase in injury risk after time away. This is when I'm the most busy, after a break, after Christmas break, after summer break, and after periods of time away. Please, please pay attention to this. Do not put them in the same program they had the day they left training, because they will all be injured. They will not be able to do it. You have to scale back your training program to accommodate the strength, flexibility, fitness changes that they will have from deconditioning. So coaching, this one's on you to make the changes to scale everything back so you don't cause an injury or illness. Lower the intensity, focus on technique, follow the advice of your sport med physiologist, increase the recovery time in between training sessions, decrease the training frequency to start off with, mix more dry land in with the pool time. So please make these adjustments in your coaching program to mitigate the deconditioning that has happened. There's no athlete in the world that hasn't had deconditioning from being on home isolation from COVID-19. Perhaps our running athletes who've been able to maintain running outside. So let's talk a little bit now, move on to returning to competition. Now this one's important. You think, wow, competition's so far away from my radar screen, but in fact, we're training for something, and we're not really training for fun. We're training for a competition. So having the ability to plan for something to train for, to have a competition to look forward to, something to get out of bed early in the morning and go to training is really important. So how do we return to competition? Well, I've been working quite a lot with the World Health Organization in the last few months through my work on the IOC. And they have some great tools to help us decide when things are safe to go back to a mass gathering or a competition. So when will they resume? Well, it'll be driven not by me and not by you, but by public health assessments. When they feel a country is safe and ready, or a city or a community is ready, the public health people will be the ones that will be helping us with this. We also encourage you not to go back to competition until your athletes are ready. And certainly with the deconditioning that's happened with home isolation, it'll be a little while before you'll get your athletes up to speed, literally. But really important to know that competition should not happen until both of those factors are involved. And then there's these WHO mass gathering event checklists. It's great. The event checklist, the risk assessment tool, and the risk mitigation tool. So I'll walk you through these. And here's the risk assessment tool. And there are 4 questions. Yes gets a score of 1, and no gets a score of 0. Pretty simple. Will the event take place in a country that has active transmission? If there's active transmission, there's 1. Will the event include participants from far countries where there's local transmission? So let's say back to March, are you inviting athletes from China, Italy, Spain, Iran? That gets a 1. Will the event include a significant number of participants at higher risk for severe disease, so over 65 or immunocompromised? Probably a 0, unless you're putting on a master's competition. Will the event be indoors and or outdoors where they have prolonged close contact? Well, if you have an outdoor swimming event, you're in a lot better shape than if you're in an indoor event. Let's say if you were a swimming event, you're in a lot better shape than if you're playing rugby, where there's a lot of close contact with the athletes in an indoor event. So that would be number 1 or a 0, and then you add up your total risk assessment score. And then there's now a risk mitigation tool. Now I've put that on the right-hand side of your screen, and I don't expect you to read it. You can look up the risk mitigation tool on the WHO website, and I've put the reference at the end of the slideshow. But these are the different areas where there's that they're looking at. So what is the COVID situation overview by the event organizers? Are they understanding how to maintain safety? What are your event emergency preparedness and response plans? Are they working with partners and stakeholders in public health? Do they have command control centers and coordination arrangements? What is the risk of communication? What are the public health awareness both before and during the event? And what's the surge capacity? Now, surge capacity means what does your healthcare system status like? If there's an increase suddenly of cases, can your healthcare system maintain the number of ICU ventilators, ICU beds, and in-hospital beds? So what's the capacity? So in my community right now, we're trying to maintain our bed count at about 70%. So we've decreased all our surgeries so that we keep empty beds so that when we have a surge, we've got extra beds available. And we have empty ventilators. About 30% of our ICU ventilators are not being used so that we can keep them available if there's a surge. So that's something that you're not going to answer, but your public health folks will answer for you. So that risk mitigation tool goes into quite a bit of granular detail, and you obviously can't read on this slide, but you can read it online. And if you're thinking of putting on an event, your best partner is your public health department that will help you come to these conclusions. And these are given a score: 2 for yes, 1 for maybe in progress, and 0 for I hadn't thought of that one. So it gives you a score for each of these, and you can see there's several of them. And you go through this risk mitigation tool to add up your readiness for risk mitigation for COVID-19. So here's just an example. Do you have a specific mitigation measures in place? What's your staff knowledge? What's your public health awareness of the events? So do public health know what's going on? Are they involved? Are you able to isolate folks if they become unwell? And how well are you communicating your plans and prevention? What's your emergency preparedness like, and logistical coordination for the event? So lots of extra layers of things that we didn't even think of before. Well, I shouldn't say we didn't think of. There's many of us behind the scenes, i.e. the sport medicine folks, that were doing many of these things, but at a heightened capacity and something that anyone putting on an event is going to have take into consideration. Okay, now this is the next tool from WHO, and this is what puts together these two things. On the top column, you have your risks. So remember I said you take a score, you put 0 or 1. So these are your risks. So if you have a 0 score, and then along the top axis there, that's your mitigation score. So that's that more complex one. So if you have a very high mitigation score with a very low risk, you have a very low risk event and you can go ahead. If you have a high risk event with very low mitigations ready, that's a very high risk event and you probably shouldn't put it on. So this is a very nice tool that you can plug your numbers in, and then you can come up with whether you should put your event on or not. Now, the whole idea is that through the mitigation, all those details on that one graph, you can start adding those in, lower your risks, and make your event more safe and more likely to happen. So it's as much an educational tool as it is a risk assessment tool to help you decide whether your event is safe or not to be held. And I think it behooves all of us. Now, this risk mitigation tool is used for all other mass events, so concerts, large large events, international events, conferences, these kinds of things. It's not just for sport events; these are mass gathering events, but they're specifically also some WHO information on holding sporting events on their websites that are very helpful. All right, so some other things about the risk in competition is what's the risks in the host country? So if you said to me, Mark, would you like to go to an event in China in January? The answer is no, because the risk of transmission of coronavirus is quite high in China at that time. It isn't now, but at the time it was. So what is the risk in the host country? Is it single venues or multiple cities and multiple venues? So think of the, say, FIFA World Cup that goes from many different cities and many different venues. It is a much higher risk than if you have a single event in an open air stadium. So are you having international participants or is it a local event? Local events are going to happen before international events because of the risk of bringing people in. What are the number of spectators, and should we be limiting the number of spectators? Should it be only spectators under the age of 65? Should it be only well people that we allow in the door? Should we be taking temperatures of everyone that walks in the door? And should we have physical distancing between groups of seats? So people who live in the same household can sit together because they live together, but between different groups of people, the ability to physically distance as well. Is it a contact sport versus a non-contact sport? So I mentioned rugby before versus swimming. I'm glad we're in swimming. But water polo is a little bit more of a contact sport, as we know, in comparison with swimming. So water polo will be coming back a little bit slower than, say, swimming or diving. Artistic swimming, if they've been training together, then of course they're very close contact. That's fine, but you don't have different teams together. So that's the difference in the team sport versus team and artistic swimming. And again, as I mentioned, an outdoor venue with air circulating or a large stadium with lots of air circulating is much safer than an indoor, a smaller indoor venue. So let's just finish up with if our athletes become ill, what should we do if they develop symptoms and how to return them to sport? So number one, do not come to the pool. I think it sounds very obvious, but I think it's really important to reinforce this. I had a similar situation. I look after training physicians and residents, and I had a resident that came to work at the hospital having symptoms, and they were too embarrassed to say that they had symptoms, so they decided to come to work because they could fight through it and ignore the symptoms. Well, they were unwell. So please remind your athletes, do not come to the pool if you're not feeling well. And that's why that pre-screening form is really important for every training session, not just for the first one. They should stay home. And when I say stay home, that means do not go out. Do not use public transport. Wear a face mask in the house and physically distance within the house. So stay in a separate room and stay away from other members of your family. Do not invite people over. Do not share household items for that individual. Separate towels, separate dishes, really physically distance and stay away. If they're having difficulties breathing, eating, or drinking, they should go to the hospital, but they should have a medical assessment and some testing for the coronavirus. How do we bring them back after the infection when they're better? Well, here is a diagram that's been recently published, and again, it's busy and you can use the slides afterwards to look at, but I'm going to highlight something. If they're having symptoms and they've developed pneumonia, they're less likely to come back as quickly. Now, a myocarditis, I'll translate that word for you. The myo means muscle and cardia is the heart. So if they have an inflammation of the muscle in their heart, coming back a lot later than if they did not have that, especially if they also have pneumonia at the same time. Quite often, if you have a myocarditis or this inflammation from the virus in your heart muscle, you will have at the same time pneumonia. Now, the athlete that has both of these, not coming back to training for quite a while. So they really need further evaluation of their suitability to come back to training. Has their heart muscle recovered to normal function? Are their lung function coming back to normal? And until the doctors clear them, they're not to come back to training. On the other side, however, if they've had either no symptoms or they're resolved, they can come back to training. Now, here's a different one. Again, not one is better than the other. They're just two different algorithms to return your athletes back to sport. And I'll walk you through again the details you can read later, but I'll highlight just some of the details. So if they have been unwell and they test negative from COVID and they've totally become asymptomatic and they're back to normal, they can go back to training. If they've tested positive, but then they've become asymptomatic and they've had no complications, then it talks you through slow return to sport after 2 weeks of remaining negative. If they've had mild symptoms and not hospitalized, then it goes through the algorithm of bringing them back to sport. If they've had more severe or significant symptoms that I mentioned in my previous slide, then it goes through what you should do for these athletes before you return them to play. So you can see, I mean, this isn't something you as a coach or a national federation would a president or a leader in your federation would do, but it gives you an idea that if my athlete's unwell, where do they land in this, and make sure that they receive the appropriate medical care and guidance on returning them back to play. Because athletes can become quite ill and quite severe, and you want to make sure that they're cleared properly from a lung and a heart and a muscle. Remember, all those things are affected before they return to any training for the health and safety of your athletes. Finally, I'll leave you a page of references before and they're here. I won't go through them here. You'll get the slides after, and you can access these WHO documents that I mentioned to you before that are very helpful, I find. These are some of the other documents that I've used in the development of this presentation today. If you want to actually get the particular documents that I used, if you're not able to access them on your own, please just send me an email, and I'd be very happy to send the documentation to you for your own information. And finally, I think I'm going to hand it over for someone to moderate the chat. Hopefully you've been either writing things down in the chat, or we can open up the microphones for some questions. So before we go to those, I'd first of all like to thank Felix as CCCAN president for inviting me to speak to all of you today. And most importantly, I'd like to thank all of you for your attention today, for your concern on returning to training, and for what you will do tomorrow, which is taking some of this information I've given you and going back to your facilities, going back to your coaches, and going back to your athletes, implementing these guidelines so that we can all get back to normal training as best as we can in a healthy way. We avoid risk of coronavirus, but we also avoid any injuries and illness from the deconditioning and reconditioning that you'll need to do, and that we return to safe competition, because I look forward to seeing each and every one of you at a CCCAN, CARIFTA, WANA, and FINA event in the near future. So thank you, and I'll now open it up for questions.